the first step in repairing a rotator cuff is the doctor is going to create a posterior portal. He's going to do this so he can get a look inside of the joint space, and he's also going to take a look at some of your soft tissue. He's going to look at your biceps tendon, your labrum, and your rotator cuff. And there's a few good indications on whether or not there is a tear in the rotator cuff. One is if you are on a subacromial level and you can see the humeral head, this is an indication of a rotator cuff tear. Also, if you're irrigating the joint space and your rotator cuff is kind of resting on your humeral or on your biceps tendon, which is running about 12 o'clock over your humeral head, this is a good indication of a tear, because when you irrigate that joint space, your rotator cuff should kind of float up, kind of like an umbrella. Also next, the doctor is going to create an anterior portal. The primary use for this anterior portal is going to be to pull the sutures out of once the sutures are passed through the rotator cuff. Okay, and next he's going to create a lateral portal, and this is where he's going to be doing most of his work. So now once you've decided, you've done your soft tissue check on your posterior portal, the doctor can also bring in a shaver and kind of clean up that joint space, make it nice and clean to move forward with the repair. Next, what the doctor is going to do is he's going to move subacromially, and then he's going to start to evaluate his repair from there. So what he's going to do is he can insert a shaver into the cannular in the lateral portal, and he's going to start to, and he can start shaving that area as well, kind of clearing it up to make the repair easier. He's also going to perform his bursectomy. So he's going to be in there with either the shaver or the vapor, and he's going to be cleaning up the soft tissue that's frayed or in the way. And then he's going to do his acromioplasty, which means he's going to go in with a burr. He's going to kind of burr out that bone, make appropriate space, just clean up the acromion if it's rubbing against that rotator cuff in any stretch of the imagination. And then what he's going to do next, he's going to take a spinal needle, and he's going to pinpoint his tear by placing that spinal needle into the tear, and he's going to create his fixation point. So now what he's going to do after he has his fixation point is he's going to take the helix punch. So he has his fixation point onto the humeral head, and is going to drill into his fixation point to the desired laser line, which is a good depth. And then what he can do from there is he can then remove the helix punch, leaving a hole. And then the next step he's going to do is he's going to bring in the helix anchor, and he's going to bring it up to that helix punch hole. He's going to screw the anchor in. Then he's going to, release, if you will, the anchor from the holder, leaving the anchor and the suture. Now what he's going to do next is he's going to go in and he's going to begin. He can choose to line up his sutures, and he could either he can match his sutures, which would be a purple suture, and a blue suture and a blue suture with the ortho cord, which is usually what doctors do, at least in the cases that I've seen. Also, what he's going to do is he is going to use the espresso, and he's going to start to pass the sutures through the cuff. Now once he does this, they'll be coming out of the anterior portal in the front. Now an important thing to remember is that when you pass sutures, you pass them anterior to posterior, and then when the orthopedic surgeon ties the knot, he's going to go from posterior to anterior. So now that your sutures are through the rotator cuff, the doctor is then going to begin to tie his orthopedic knots. He can use a knot slide to slide the knots into place, and once he does this, he's going to cut the remaining part of the sutures, just leaving the knots and your repaired rotator cuff.